Hello everyone, my name is Maya Magdi Abdul Wahab and I'm welcoming you to the series of systematic review provided by Inners International. And our topic for today is choosing a framework and planning topics for systematic review. First, we have to know the difference between the two study designs. We have primary study designs and secondary study design. Primary means original, first hand. The author of the study is also the source of the information generated or being used in this study. And on the other hand, secondary study designs is the author uses existing data, usually produced by someone else, and then analyze it and report it. Secondary reviews, second or systematic reviews are type of secondary study designs. They are already using existing data. Speaking of secondary study designs, we have literature review and systematic review. Literature review is usually has broad topic and doesn't focus on specific a question or narrow scope. Also, it may be subjected to high risk of bias as it's already up to the authors to choose which paper they would write about, which include and which exclude, and considered as expert opinion. Second, systematic review, which usually, which is, which must have specific questions and narrow scope, as well as it's comprehensive as follow systematic steps, and it has a pre-prepared protocol. Meta-analysis Meta-analysis is a statistical part of the systematic review, and not every systematic review has meta-analysis. Meta-analysis is only done if applicable and feasible. What is the importance of systematic review? Number one, they provide reliable and high quality evidence and informed decision making. As we, as clinicians or researchers, we shouldn't rely on individual studies. Thus, systematic review act as well-structured summary of literature, collecting all the data and presenting it from multiple studies, so we can know safety and efficacy of health intervention or the accuracy of diagnostic tests. Number two, it reduces bias. Number three, identify knowledge gap. Number four, improve transparency and reducibility, as we know it has a protocol that is shared for everyone and everyone can repeat the steps. Systematic review can be classified into three categories according to the design of included studies. First, systematic reviews of observational study. In this observational study can be either cross-sectional, so we could estimate condition prevalence, or case control and cohort studies to estimate the exposure effect on the clinical outcome. Second is systematic reviews of diagnostic test accuracy studies. And this type of review aims at the evaluation of the accuracy of diagnostic tests. Third, systematic reviews of interventional study, which is concerned with with estimating the safety and the efficacy of the treatments. The present statement suggests that systematic review should be registered to be published in medical journals. As a result, the Center for Reviews and Dissemination created the Prospero database as a global registry for a systematic review. Systematic review protocol describes the rationale, hypothesis, and planned methods of the review. It should be prepared before a review is started and used as a guide to carry out the review. Detailed protocol should be developed a priori, made publicly available, and registered in registries such as RESP. Now we will talk about the steps of the systematic review. Number one, identify the review questions, which is formulating well-defined research question. Number two, define the eligibility criteria or what's called inclusion and exclusion criteria, which will be used to determine whether or not the study will be included in the research. Number three, searching the literature. Searching the literature, we will run research in databases that what we identified as relevant to our topic. Or screen of relevant records, which is selecting the studies based on the predefined criteria as either included or excluded. 5. Extract data from included studies. Using a spreadsheet or systematic review software, we extract all relevant data from each included study. 6. Evaluate the risk of bias of included study. Use risk of bias tools to assess the potential bias of studies in regard to study designs. 7. Sensing data and present results, which is writing the systematic review to present the findings, including the methodology and the results. Here, we will talk more about how to formulate the review question. Our topic today is mainly focused on the first step, the identification of the review question. The review question of systematic review must be specific. It also has to cover a narrow scope. And for a good question to be considered a good question, it has to follow finer criteria, which we will talk about in details in the next slide. Also, the systematic review of intervention should follow the domains, which also we will talk about in the next slides. So now let's talk about finer criteria for a good research question. For finer criteria, each letter means something. For example, F means feasible, like we have adequate number of subjects, adequate technical expertise, affordable in time and money, and manageable in scope. I means interesting, as the research question has to get answers that is interesting for the investigator, peers, and community. And novel, which confirm or extend previous findings. E. Ethical, which is the study that amenable to a study that institutional review board will approve. R. Relevant. Relevant to scientific knowledge, to clinical and health policy, to future research. We frame research question according to PICO format, which here P either represent patient, population, or a problem. Like, how would you describe a group of patients similar to yours? What are the most important characteristics of the patient? Like, we have a research question on people who suffer from osteoarthritis. I means intervention, or it can be E, which means exposure. Which main intervention or exposure are you considering? C means comparison. What is the main alternative to compare with the intervention? Like in treating something which is more useful or more effective. Type A treatment or type B treatment. O. Outcome. What can you hope to accomplish or measure or improve of this research? Like if we are talking about the efficacy of the treatment, so we can say that the symptoms elevation or is like our outcome. There are a lot of types of research questions, and here I give you some examples. Number one, intervention or therapy, which used to determine which treatment leads to the best outcome. Etiology question type, which is used to determine the greatest risk factors or the cause of condition. Diagnosis or diagnostic test, which used to determine which test is more accurate and precise in diagnosing a condition. Prevention, which used to know how to reduce the chance of disease by identifying and modifying risk factors. Meaning, used to determine the meaning of an experience for a particular individual, group, or community. As we reviewed the types of questions, let's have some examples on them. Here is the first scenario of the first examples. We will give example of type of question which is survey. We have scenario that we have a female patient who has recently been diagnosed with systemic lupus erythematosus. Her rheumatologist suggested she start on Plaquenil for her joint pain, but she is interested in alternative therapy because she heard about a success of her neighbor which had with turmeric tea. So basically here, when we will apply the PICO, we will have the P or population of interest here will be the patient with SLE. The investigation or the intervention we want now is turmeric tea compared with the standard drug therapy which is Plaquenil, and the outcome here is the reduction of joint pain. So we have here all elements of PICO and we can frame our question, which can be framed in any way, but of course we will have the PICO. Like in adult patient with SLE, is consuming turmeric tea more effective than Plaquenil at reducing joint pain? And here we have our research question. The second scenario is for diagnosis or diagnostic tests. We have patient has a history of blood clots and after they come into the clinic with right calf discomfort and tightness, you are concerned about deep vein thrombosis. You remember reading about the limitation of duplex ultrasound and are wondering if a D-dimer assay can help you rule out DVT more accurately. So here is the diagnostic test which we concerned about which diagnostic test is better than the other. So here the intervention will be the D-dimer assay and the comparison will be the ultrasound and our outcome will be the accuracy of in diagnosis of DVT and the patient here is adults or adults with blood clots can be like this too. So here's the question will be, is D-dimer assay more accurate at ruling out deep vein thrombosis compared to ultrasound? And now for how to get research idea. You can get a research idea by searching the literature. Like you can search for something you are interested in, so it will be more relevant if you care about your topic, and then narrow your topic to something manageable, like to have more focused scope and to not have like a too broad with too much information, so you will not be able to focus on it. Or you may develop like skeptical attitude where you always ask why, and when asking why you might have a question. Or by being observer, like attending conferences or by imagination, you might find something that is interesting to know, or you will have a gap of knowledge which have to be addressed. That's all for our video today. Thank you.